Pelvic inflammatory disease. Pelvic inflammatory disease (PID) is an infection of the female reproductive system, which includes the womb, fallopian tubes and ovaries. Symptoms of pelvic inflammatory disease (PID). Pain around the pelvis or lower tummy. Discomfort or pain during sex that's felt deep inside the pelvis. Pain when peeing. Bleeding between periods and after sex. Heavy periods. Painful periods. Unusual vaginal discharge, especially if it's yellow, green or smelly. A few people become very ill with severe pain in the tummy, a high temperature, fever, feeling and being sick. When to seek medical advice. It's important to visit a GP or a sexual health clinic if you experience any symptoms of PID. If you have severe pain, you should seek urgent medical attention from your GP or local A&E department. Delaying treatment for PID or having repeated episodes of PID can increase your risk of serious and long-term complications. There's no simple test to diagnose PID. Diagnosis is based on your symptoms and the finding of tenderness during a vaginal internal examination. Swabs will be taken from your vagina and the neck of the womb, cervix, but negative swabs do not rule out PID. Causes of pelvic inflammatory disease (PID). Most cases of PID are caused by a bacterial infection that's spread from the vagina or the cervix to the reproductive organs higher up. Many different types of bacteria can cause PID. In many cases, it's caused by a sexually transmitted infection, STI, such as chlamydia or gonorrhea. Treatment for pelvic inflammatory disease (PID). If diagnosed at an early stage, PID can be treated with a course of antibiotics, which usually lasts for 14 days. You'll be given a mixture of antibiotics to cover the most likely infections, and often an injection as well as tablets. It's important to complete the whole course and avoid having sexual intercourse during this time to help ensure the infection clears. Your recent sexual partners should also be treated for any sexually transmitted infections that may have caused your PID. This will help stop it coming back or spreading to other people. Complications. The fallopian tubes can become scarred and narrowed if they're affected by PID. This can make it difficult for eggs to pass from the ovaries into the womb. This can increase your chances of a pregnancy that grows outside the womb, usually in the fallopian tubes, ectopic pregnancy. This type of pregnancy cannot be saved and can cause life-threatening problems. If you keep getting PID or treatment is delayed, it can increase your risk of infertility. Preventing pelvic inflammatory disease (PID). You can reduce your risk of PID by always using barrier contraception, such as condoms, with a new sexual partner until they have had a sexual health check. Chlamydia is very common and most people do not have any symptoms. If you're worried you may have an STI, visit your local genitourinary medicine, gum, or sexual health clinic for advice. If you need an invasive gynecological procedure, such as insertion of an intrauterine device (IUD) or an abortion, have a checkup beforehand. Thanks for watching. Subscribe for more informative videos. Pelvic inflammatory disease.